What do you think are the most interesting questions around women's health that we don't yet have a clear answer to, that could be answerable if we had the resources to study it and the will to do so?
I think one of them is women ultimately want to lose weight. So how do we combine our GLP-1s with the kind of what I would call minimal effective dose of exercise and nutrition in a way that women can still live their lives and feel good? So many women are not feeling great on those drugs, or they're not feeling good off the drugs. And so there's also a very big component of mental health in here that I know exercise can have a really important role in. The other big question that I think is really important is the impact. We've seen a swing, and I would be curious of your take, that there's much more conversation now around menopause hormone therapy. And I think there's a lot of indirect effects on muscle and training volume, but how much? For instance, adding hormones isn't going to increase muscle directly, but indirectly, maybe I have more energy, or I can do higher volume and
I can
intensity.
recover better.
Exactly. Yeah. But then does that also put me at greater risk for injury? Or like our tendons still change? Actually, one of the things I think we have in common, my biggest injury fear is an Achilles tendon tear. And so I think about that a lot, of like, how do some of these changes in hormones and really helping women feel better with this new wave of very active women? They're women that are training, like, how do they combine? And then that has application to the military, et cetera. But we need to know a lot more as we're changing our pharmaceutical agents with our lifestyle components.